I guess you've already heard from a gardener. There's been, a cook. We've had a mountaineer. There's a businessman you've heard from. I'm the medicine geek. And so what today I've set myself is 3 easy questions to answer, I hope. The first question is, what is FSHD? The second question is, what is FSHD global research doing about this disease? And the third question is offering at least a suggestion as to what you might be able to do to contribute to help us on our quest. Now, I know there are some people who, up until tonight, probably didn't even know that FSHD existed or what FSHD was. And so it might amaze you to hear that it was first identified 130 years ago by 2 neurologists who named it FSHD after facioscapulohumeral muscular dystrophy. Some of you have been drinking, I haven't, and therefore I've been able to say it clearly tonight. Why is it named facioscapulohumeral muscular dystrophy? Because it affects the muscles of the face, of the wing bones or the shoulder blades, and of the humeri, the upper arms. It is in fact a progressive muscular degenerative disease that has an enormous clinical variation. It can be devastating in the very young, appearing very early at life, and it can be invisible up until the 50th decade. But what we know is that 20% of people are in a wheelchair by the age of 50. And I'm reminded of this wonderful dinner that we've been going to now for a number of years for fundraising. And when Bill first attended this magnificent chocolate ball, he walked with his walking stick up onto the stage. And today, you see how he has arrived. That is the inexorable progress of this devastating disease. And remember, Bill's autobiography, Still Walking, is available outside, I'm sure, if you want to purchase it. So this is a progressive disease. It is a dominant disease. And because it affects people differentially, it means that some people have reached their reproductive years without even knowing that they carry the abnormal gene. And that means that they can pass that on with a 50-50 chance to their offspring. We also know that it can affect twins completely differently. Even identical twins can have completely different courses. And as you probably read in the program, Mitchell and Sophie's story, it can be devastating in infants even after a first few months of life. Imagine having a baby that can't do normal activities even after 6 to 12 months or the first few years of life. A devastating shock to parents who thought they had a normal baby on the way. It can affect different organs, it can affect the eyes, it can affect the ears, but ultimately it affects most of the muscles. And the other aspect of it is that it's oftentimes asymmetrical, something I spoke about last year on this very stage. It can affect one side differently to another side. So what about what FSHD is doing for this disease? Well, that's a story in itself. About 8 years ago, Bill came to me and said, I'm a successful businessman and I don't know much about science and medicine, can you help me? And I said, well, I don't know that much about FSHD right now, but I'd be happy to help you because I can do one thing, and that's spend money really well. Scientists love to spend money on difficult problems, and FSHD is a really difficult clinical and genetic problem. When we first planned a strategy to attack this disease, the government didn't spend any money on FSHD and continues not to do so. There are several other foundations around, but the interest in the disease amongst the scientific and medical community was very little. This disease affects 7 per 100,000 people all over the world and doesn't distinguish between race, colour or creed or sex. It can affect men more than women, but indeed it affects all races and all types. So what we did was decide to attack the disease at its root cause, to understand its genetics, and then progress that scientific research into translational medicine and then clinical trials of drug screening, which we are now currently pursuing. That's cost a lot of money. You've heard $3.7 million distributed throughout the world, 22 different grants, 7 different countries. And that's all been done by anonymous peer review by a panel of unpaid scientific experts who pore through these applications. We ask the whole world to put in the best possible applications for FSHD. They come up with their applications that sometimes count to dozens and dozens of pages of proposals, and then we assess them on their merits, and then we offer the money. for those grants to be awarded. And that's what the money that you will be hopefully donating tonight is used to achieve. We've made some incredible success, some home runs in fact. We've had some of the biggest discoveries that have taught us the genetic complexity of this disease. We've established stem cell lines by the company Genea, and we've undertaken to extend that to other corporate entities. And perhaps most excitingly, in February of this year, we advertised for the Novel Concept Grant. We said, all right, we've funded for some years now research towards understanding the genetics and translating that into the clinic. But what about giving us your best, craziest idea? And we received 14 incredible grants from all over the world directed towards FSHD. And we couldn't believe the quality of these grants. The committee that assessed the grants thought they were all very worthy, but we recommended 2 for funding, each of $300,000 over 3 years, 1 Australian and 1 from overseas that we'll be finalising in the coming weeks and days. But in addition to that, we couldn't control ourselves. As I told you earlier, I could tell Bill how to spend his money very, very easily, and we recommended an additional 3 grants for partial funding just because they were so exciting and so novel. So there's what we've achieved with FSHD Global Research is to bring interest and activity into a disease that's been mostly neglected. Originally, we had a fundraising program that was Save Our Smiles. And because you've seen the FSHD logo, the F and the S and the H, and then the D is the smile of the face. It's because people with FSHD often can't smile because the muscles in their face are unable to work as well as the rest of their, as well as the muscles in a normal body. They can't say the letters P or M or B as easily as normal people because of the lips and because of the mouth can't pucker as normally. But I think Bill's still a very good kisser according to Lata. In any case. So we've achieved a great deal in the several years that we've been going, but we want to do more. And therefore that allows me to answer the last question, what you can do. And when I was reflecting on that last question, I wanted to highlight to you something that is always immediately evident to me. We're all so busy. These days, I don't even get out invited to a drink with my friends. They just say, well, you're obviously too busy, Professor, so you wouldn't be able to come out for a drink. I say, well, ask me anyway, at least. Nonetheless, we're all so busy, and I'm sure there were some arguments getting here on time, the traffic, the taxis, putting on the makeup, and that's just the guys. Imagine if everything that you had to do in preparation for tonight took 10 times as long. Took 10 times as long. 10 times to go out shopping for the outfit. 10 times to have a shower. 10 times to get dressed. 10 times as long to do the things that we mostly take for granted. That's what someone suffering with FSHD has to suffer. And so I ask you tonight to dig deep. This is an important charity. We've proven we can make a difference. Tonight is the night that we exercise our ability to demonstrate our support for this charity, and I hope that those 3 additional grants that I'm so excited about will be funded on the basis of the money that's funded tonight. It can only be done if you dig deep tonight and give with all your hearts in support of this devastating muscular dystrophy. Thank you very much.